interesting.
All
Beans!
right. That is us with the recording on. Hello, everybody. Thank you so much for tuning in. Thank you to those of you that are with us here live. Thank you to Romy for being here, and thank you to all of you listening at a future time. I'm really excited to have you in tonight into the community event because I have Romy Worthington. And Romy, I got to hear you speak in person, which was even better, almost a year ago, if you can believe it,
Yeah.
at the TIC Symposium. And I knew before that conference weekend that I had to get to your talk. Pans and Pandas has been something that um, I've been questioning for part of my experience as a teen. And then when I first learned of Pans and Pandas, it was discussed as something very, very rare. And as I've been out in practice, I've noticed this is not so rare. And we really need to increase awareness of it and really help with people understanding how and where to get support. So I thought I've been wanting to host Rami for a long time. So I'm so glad it finally happened tonight. I just have a few slides before turning you over to Rami, just to give a bit of housekeeping and to just say hello a little bit. So for the housekeeping, when Rami is speaking, you may want to pin Rami's image because I think right now on mine, like I'm right at the top. Um, and to pin Rami, what you can do, if you move your cursor to the upper right in the box of their picture, there's three little dots. And you can, if you click on that, then you can pin the speaker. I put about the muting camera and the cameras turned off just because we're recording. I'm letting in someone else. I'm just going to say hi to them and make sure they got in okay. Hello, good evening. If you just come in, we're only just starting, so no worries at all. We're just saying hi to everyone and going over a little bit of the housekeeping and was just saying that we're having cameras off and muted just for your privacy because we did start recording and this will be going out to people. But we will have a Q&A at the end after we turn off the recording. So that way, if you want to come on and ask questions throughout the whole time, I will be in the chat. So if you have any questions, concerns, or if something's resonating with you, I will be in the chat the whole time. I can drop in links or anything else that's needed. If something has come up that you need some help with, you're welcome to private message me on here. That's absolutely fine. So again, we're recording, but please no recording of yours. That would be great. Throughout the whole time, my last 2 points really have to do with the idea of taking care of ourselves throughout. You know, you might have signed up to a webinar some weeks ago and thought, yep, I'm going to be in a good spot to be listening and stuff. And then maybe this evening you're not feeling so well, or maybe tonight you're extra fatigued. That's totally okay. We are recording, so you'll receive an email from me with this. And there's no pressure to take part. If you're kind of hanging back on the couch, just having a bit of a rest, that's fantastic. You don't have to be adding in questions. This is really for you. This is also for Rami to platform Rami. Self-care during the time is really important. So we're going to take mini breaks. We're probably going to take a break partway through. I've got my tea, but anytime that you need to go get your kettle on, use the restroom. If you have a phone call come in, we totally understand. Taking care of your movement needs as well. So you'll see me adjusting quite a bit because I'm quite the mover. So I find I have to be moving around to see me my screen doing that. But again, anything that comes up, please do message me or I'll be in the chat as well to be helpful. So I'm going to just do a very quick on me. I'm Laura. Hi. So you would have seen me on the Eventbrite. And you can find me under Neurodivergent Nurse Consulting. I'm basically interested in kind of anything health and medical wise, particularly then intersecting with neurodiversity. So this topic today means a lot to me. And then I'm going to be introducing Rami, who is our advocate and educator that's with us today. So we've got Rami with us. Rami is an advocate with their lived experience. So I always find that to be extra important that we're hearing from someone who has gone through this, going through this, and really knows what it feels like. Um, as I was mentioning, that I got to hear you talk about pans and pandas before. So you're really passionate on this topic. And I know when I've sent you some emails to get some help for some other families, you end up sending me the most gorgeous emails back with all these links and people to go to. You just want to be so helpful in this area, which is great. And we're also going to talk today about diagnostic overshadowing, which I think is really critical, especially if you are, oh, I've got someone else coming in. I'll just let them in out of the waiting room.
Beans, don't let them in. Bye. Sorry, that was a tick. I do want you in. Hi. Sorry.
That's all right.
Hello.
Making sure they got in. Thank you so much. We are just kind of going over the housekeeping and welcoming people in. We have our cameras off and muted just for your privacy because we have started recording. And I was just introducing Romy, who is going to be our educator today on their lived experience and discussing so much around PANS and PANDAS, but also how that intersects again with other type of neurodivergences, diagnostic overshadowing. I know I'm going to probably end up wanting to come in and comment on FII, or the fabricated induced illness. That's where I end up interacting with a number of families here too. So you've been an advocate 10 years. And being an advocate is a lot of work, and it's emotionally a lot of work. So we're very, very grateful to have you here. Thank you so much. I'm going to go ahead and stop my sharing because that's what I've got. And then we practiced this earlier, but let's see if we can do it again. Is
Hello.
I'm going to pass over, make host to Rami. All right, change host. So hopefully,
It worked.
woohoo,
Yay. Okay, so share screen. Boop, boop, boop. This one. Hello, everybody. Let's not stop. There we go. So, can you see this?
yes, fantastic.
Yay!
Yay.
Fabulous. Fuck off. That's not a great start. As I said, sorry, I do have Tourette's, so I will tick. Some of my ticks are inappropriate, so just bear with me with that. Also, I don't mind if people laugh at certain ticks because, to be honest, sometimes I laugh at my own ticks because I'm like, well, that was random. So yeah, just so you know, that's why I'm going to be yelling random things every now and then. Yeah, but today I am going to be talking to you all about pandas and pans, which, fuck off, they are very misunderstood conditions, but I hope that by the end of this, you'll have a more thorough understanding of it and will understand also how it can intersect with innate neurodiversity as well. Fuck off. Ah! Beans. So what is PANDAS? PANDAS is a condition triggered by a group A streptococcal infection, such as strep throat or scarlet fever, and it causes the immune system to get a bit confused and attack part of the brain, which is right in the middle, called the basal ganglia. That leads to inflammation, which then leads to neurological and psychiatric symptoms. Hey, fuck off! The main symptoms are tics or OCD after a strep infection, and these tics and this OCD can be quite severe as well. But what about PANS? A really common question is, what's the difference between them? Because the symptoms are very, very similar, pretty much the same, actually. The only difference really is that it's triggered by a different thing. PANS can be triggered by factors other than strep, so almost any infection, really. Some people have it after chickenpox, mycoplasma, Lyme disease, the flu, EBV, and unfortunately even COVID. Some people with long COVID develop PANS as well. Fuck off. And to be diagnosed with PANS, a person needs either OCD, so that can be like intrusive thoughts and compulsions, or food restriction, which is often diagnosed as avoidant restrictive food intake disorder, or even anorexia, plus symptoms from 2 other categories. And those other categories, hello, woohoo, can include anxiety, and that can obviously be generalized anxiety or a more specific form such as separation anxiety. That's actually really common in people with PANDAS and PANS. A lot of people with PANDAS or PANS really struggle, for example, to sleep in a room on their own even because of the intense anxiety. And emotional difficulties as well are very common: depression, mood swings, even mania. Behavioral and developmental regression is also often seen as well, and that can look like a person babbling, or they kind of just act younger and go back on milestones a little bit. Irritability, aggression, and or severely oppositional behaviors can also occur, and that includes rage attacks, which are involuntary outbursts of extreme anger where a person, may be violent towards themselves or others, but again, it's not a reflection of the person. It's caused by neurologically misfired signals caused by the brain inflammation. A deterioration in school performance, which can include woohoo, beans, not that, memory and concentration difficulties, a decline in handwriting ability. That's actually a really big thing. A person can have really neat handwriting usually, but in a PANS flare, it can actually be really difficult to even read the handwriting. So that's a big thing as well. And a decline in maths ability. I actually know some people in the community who lose the ability to even count, even though they're, a teenager or an adult. It can be quite extreme and quite dramatic. Motor or sensory abnormalities are also quite common. This can include sensory sensitivities, pretty much any form, sensitive to light, sensitive to sound, sensitive to textures, tics, that can be motor and or vocal, coordination decline. Some people in a flare may seem a little bit clumsy. And somatic symptoms such as sleep disturbances or urinary incontinence or an increase in urinary urgency. And, as I said, you only need two of the following to meet diagnostic criteria in conjunction with OCD or food restriction. And the diagnostic criteria does say that the onset needs to be sudden. However, we know now that some people have a more subacute onset. It said that about 60% of those at the Stanford Immune Behavioral Health Clinic actually have a more gradual onset. So sometimes the onset isn't completely overnight, but it creeps up and creeps up and creeps up until a person has loads of different symptoms. So why is it so important, fuck off, to distinguish between PANS and innate neurodivergence such as Tourette's? As I've said already, I actually am kind of in an odd situation where I have both. I am innately Tourettic, but my difficulties are exacerbated by PANS, so by infections and things. Fuck off, which makes my tics more severe, OCD more severe, and causes a lot of other problems that usually aren't seen in people with Tourette's. But the main reason why it needs to be distinguished, whether it co-occurs or whether you have one or the other, is mainly because the management strategies are different. For Tourette syndrome, the intervention is based on just managing symptoms. So, for example, you might be referred to comprehensive behavioral intervention for tics, which can help a person redirect tics that are painful or problematic in some way. Or you may be given medication, such as antipsychotics or clonidine, to try and reduce the severity and intensity of the tics. Whereas these interventions may also be used to manage the tics in PANDAS and PANS, but PANDAS and PANS symptoms usually won't improve that dramatically until the underlying immune issues are addressed. So that's the infection and inflammation. You need treatments that address those things specifically. Because also with all the other symptoms that occur with PANDAS and PANS, the only way to really address them is to get to the root cause, which is the inflammation. And as well as this, I did say, but the symptoms can be different. Of course, there is a lot of overlap. Tics and OCD, tics are part of Tourette's. OCD is very common in people with Tourette's. Same with PANS, although not everyone with PANDAS and PANS has tics. But there are some differences in symptoms. As I said, people with PANDAS and PANS may experience things like developmental regression. Sometimes even psychosis can occur. And personality changes and a dramatic decline in academic ability, coordination decline, just lots of traits that usually aren't seen in people with Tourette's. And the thing is as well, a diagnosis of PANDAS or PANS makes a person very conscious about avoiding infections. They see why it's so important to have that, sense of hygiene and try and avoid all the infections in any way possible, because an infection can trigger a very severe flare and, supporting their immune system in general. As well as this, it's interesting, but the symptoms can change in each flare with PANDAS and PANS. For example, a person in their first ever flare, when they first develop it, they might struggle with, for example, a lot of OCD and a lot of anxiety and depressive symptoms. But in a future flare, They might start developing tics, hyperactivity, academic struggles. So it's actually really important to have a diagnosis of PANDAS or PANS, because if someone just has a diagnosis of OCD or just has a diagnosis of Tourette's, it would be, well, I can say not just it would be, but it is really confusing when you suddenly develop all these new issues that seem to have nothing to do with what you were originally diagnosed with, because that, I experienced that and it is very confusing. But if you have a diagnosis of PANDAS or PANS, then you understand what's going on if you suddenly develop these new traits and you feel less scared by it. And also, another thing as well, pedophile, no, fuck, hey, sorry. Another thing as well is that it gets people to check for chronic infections. Not everyone with PANS has chronic infections, but some people do. And these chronic infections may not respond very well to, broad spectrum antibiotics. You might need a very specific one. As well as that, sometimes the reason people might not respond to the PANS treatments is actually because they have a chronic infection going on that needs to be addressed first. So in some cases, it can be relevant just so that you know that there is a potential link between PANS and chronic infections, so that you can look into them. So I wanted to talk a bit more about the overlap between Tourette's and PANDAS and PANS, because I would say that's where a lot of the confusion lies. A lot of people think that it's kind of the same thing. And again, although there's similarities, there are also differences. So with Tourette's, tics are always present. Everyone with Tourette's has tics at some point, basically. But with PANDAS and PANS, not everybody has tics, but it's thought, according to Stanford University, that about 75% of people with PANDAS or PANS have tics at some point. OCD does often co-occur with Tourette's. A lot of sources say it's around 60% of the time people with Tourette's have OCD. And again, OCD is very common in PANDAS and PANS as well. A difference, though, is that with PANDAS and PANS, a person may experience severe food restriction. They might stop eating and drinking because they may fear that the food is contaminated in some way, or that they will get food poisoning, or that they, some people actually do have body image issues with PANDAS and PANS. It's often related to fears about just contamination, but sometimes it is a body image thing as well, obsessive thoughts about that. And that isn't usually seen in Tourette's as much, at least not developing at the same time as tics. ADHD is actually a really common co-occurring condition with Tourette's, around 75% of the time. Of course, sources vary, but that's kind of an estimate. And PANDAS and PANS can also be associated with ADHD-like traits. For example, a person in a flare might become quite impulsive or restless. They might struggle to focus. And the difference is, though, that a person who actually has ADHD would have had some traits their whole life. But with PANDAS and PANS, it's actually possible for a person to not develop any ADHD-like traits until their teenage years. And it's different from, just unmasking. It's something that kind of explodes with all of these other symptoms. And, it's quite unexpected because it's not something that a person's experienced before. That was actually something I experienced. I have had some ADHD traits my whole life, but when I had a PANS flare when I was 17, they got really, really severe to the point where I couldn't check over my work. I literally could not go back and read my work because it took too much focus and I didn't have that. I was constantly moving, and I hadn't had restlessness that severe before. And as well as that, I was struggling to even write sentences because I would lose my focus and I would write the same word over and over again because I would just forget that I've literally just written it. So even in people with pre-existing inattention hyperactivity, it can dramatically explode during a flare. Shit! Pasta. Fuck off, sorry. Rages are a possible symptom of Tourette syndrome. In fact, the rage attacks are said to be the main reason why people, like families of someone with Tourette's, seek help for the person. But rage attacks can also occur in PANDAS and PANS as well, probably because the same part of the brain is affected. The basal ganglia is impacted in both Tourette's and PANDAS and PANS. And again, these rages are uncontrollable. They cannot be disciplined out of a person. Psychosis is unfortunately something that can occur in PANDAS and PANS. It's thought to occur in about 25% of cases. So, hallucinations, delusions, that kind of thing. Thankfully, that isn't really associated with Tourette syndrome. It's definitely not common for people with Tourette's to have psychosis. And dilated pupils are really common in a PANDAS flare. A lot of people assume this is related to anxiety, and in some cases it definitely is, because when you're anxious, you go into fight or flight, and that can cause your pupils to expand. But it's also sometimes related to just general dysfunction of the autonomic system. Even when you're not anxious, your autonomic system can misfire signals. The autonomic system is what controls automatic things in your body, like breathing, heart rate, blood pressure, and your pupil dilation and constriction. Handwriting difficulties are pretty common in people with Tourette's. For example, the tics might make you stab the page. I've had that tic quite a lot, or scribble over your work. And also, Tourette's can co-occur with dysgraphia, hypermobility, and other things that impact handwriting. But with PANDAS and PANS, it's often quite a dramatic decline. A person's handwriting can change sometimes quite quickly, and it seems quite out of the ordinary. You know, people might start writing bigger, or it might just be illegible. Sensory processing difficulties are common in both, but seizures, fuck off, can occur in PANDAS and PANS, but seizures are not really linked to Tourette syndrome. As well as this, I have said that in the past, the thing that distinguished it was whether it was sudden onset or not, but that's not really what distinguishes it anymore, because we know now that not every case of PANDAS and PANS is overnight. A lot of cases are, but not all of them. So that can't necessarily tell them apart completely. However, if you do suddenly develop lots of different symptoms overnight, then that's a good sign that it probably is PANS, because that isn't really how many other things present. Tourette syndrome isn't likely to flare with infections. In fact, a lot of people with Tourette's actually say that when they're ill, their tics decrease. Whereas with PANDAS and PANS, if you get an infection, it's probably going to make things a lot worse. Although not necessarily with every infection. Some people will respond to very specific infections. Like with PANDAS, it will be strep. For someone like me with PANS, I don't really know why, but I flare with some viruses, not others. It's very unpredictable. Tourette syndrome doesn't respond to antibiotics. You won't see a decrease in tics. However, PANDAS and PANS is often actually treated with antibiotics, because if you get rid of the underlying infection, it can reduce some of the inflammation. And also, antibiotics have a immunomodulatory effect as well, which can be quite helpful too. So if a person sees a reduction in tics or OCD or other symptoms with antibiotics, that means it might be PANDAS or PANS. Tourette syndrome is a lifelong condition. Some people will say, like, you grow out of it by adulthood. But the reality is that, fuck off. Even when tics do decrease in adulthood, you're still left with a co-occurring condition, so it is actually a lifelong condition. PANDAS and PANS, interestingly, some people who are treated very early on in their first flare don't see a relapse. However, there are people like me who are more chronic cases where it is more of a lifelong thing now, because we went untreated for so long. Now, this is a bit of just a thought exercise to imagine and kind of put yourself in the shoes of what families dealing with PANDAS or PANS are going through. So, you know, imagine having a child who's happy, carefree, and doing really well at school, but they get a simple throat infection and they seem to change. And you're confused by this because throat infections are really common in kids and young people, so it doesn't seem to make sense. They can no longer play with toys or perform daily tasks. Their mind is a constant stream of unwanted and distressing thoughts, and 9 hours of their day are now consumed by rituals. They reach out to grab objects, but they miss because their coordination has declined. They cry for hours, and nothing can calm them. They're stuck in a deep depressive state. They start wetting the bed, saying phrases uncontrollably, becoming aggressive, and zoning out and losing awareness of their surroundings every now and then. You try to get answers, but no one seems to have them. So why is it so hard to get a diagnosis? It's a condition that can be truly debilitating, so why is getting a diagnosis such a struggle? I would say the main reason is that it's seen as relatively new in the medical field. The UK government only announced that they're real and distinct conditions in 2023 when they had a parliamentary discussion about it. PANDAS wasn't discovered until 1998, and PANS wasn't discovered until the early 2010s. So, in the grand scheme of medical science, they are relatively new conditions, especially compared to Tourette's, which was discovered in the 1800s. So, many doctors were actually never really taught about PANDAS or PANS in medical school, seeing as they are relatively new. And even when it was discovered in 1998, they had to do a lot of research from then to keep proving that this is a real distinct condition. As well as this, a lot of doctors tend to diagnose based on symptoms rather than underlying cause. So, if they see someone dealing with rituals and intrusive thoughts, they'll say it's OCD. If they see someone who's impulsive and restless, ADHD. If they have lots of tics, Tourette's. If they have seizures and lots of unexplained neurological symptoms, they might diagnose FND. So, a lot of doctors diagnose based on the symptoms, the clinical presentation, rather than underlying causes. They don't usually run full blood tests for infections and autoimmunity. The sad thing is as well that it is very difficult to access certain PANDAS and PANS treatments on the NHS. So some doctors might not see the point in diagnosing it. But I do want to give some hope. It isn't actually impossible to get PANS PANDAS care on the NHS. Some people have seen some hope and have been able to get antibiotics, for example, from their GP by taking a leaflet to their GP and asking for a trial of them. And if you're lucky enough to live in an area where there is actually a PAN specialist nearby, there are a few neurologists and immunologists in the UK specialising in it, and some of them do work under the NHS. If you're lucky enough to live in their local area, you can get referred to them, but it is a bit of a postcode lottery. Otherwise, you can get an individual funding request as well, which is where the NHS can help fund private treatment sometimes. So there is still hope. I'm a frog! Woohoo! Fuck off. Fuck off. Sorry. Another thing as well is that because it presents differently for different people, it can look like two totally different conditions in different people. For example, one person may struggle with really bad intrusive thoughts, mental compulsions, which is where the rituals are kind of hidden in the mind, like affirmations in the mind, separation anxiety, depression, and hallucinations, whereas another person may struggle with tics, non-epileptic seizures, sensory processing issues, panic attacks, and restricted eating. And because these symptoms are very different, doctors might not think that it's actually the same condition causing it.
Romy,
Some common. Oh, sorry.
I'm
Sorry.
so
Did you?
sorry. I know it was like how to gently be like, hello, hello. I have
Sorry.
a
Hi.
question that
Sorry.
came into the chat that was related to the diagnostic stuff you were talking about. And I actually have
Yes.
the same question too. Actually, I've been writing a bunch of things. It, the question has to do with the person recalls reading that to receive a diagnosis, you have to first rule out basically everything else, it seems like.
Yeah. Yeah. PANS is said to be a diagnosis of exclusion. So that's why, like, some doctors will do an MRI brain scan first. Fuck off. Sorry. Fuck. To make sure that it's nothing that can be picked up on a scan. Um, it's kind of like if you are outside of the box in a way, if you don't fit directly into one diagnostic category, then you might start thinking PANS. For example, when I was younger, my psychiatrist would always say I was under the umbrella of neurodiversity and psychiatry because I seemed to borrow symptoms from pretty much everything. And now I know the reason for that is PANS. That's why I didn't fit distinctly into one box. So basically, a PANS diagnosis is sometimes given if there's just nothing else that's a better fit, and that is really the only thing that could explain it. And as well as that, that's why doctors will just do a load of blood tests as well. But things that can support a diagnosis include a positive response to antibiotics or a positive response to anti-inflammatories and things like that.
That's really, really helpful. Thank you so much. And I have kind of like a second question, the
Yeah.
diagnostic thing that's kind of related to that question too. Of I've noticed with some of the families that I see that there's a lot of resistance from
Mm.
the profession, other medical professionals involved to give that PANS or PANDAS diagnosis or to even begin looking
Yeah.
into it despite what's in front of them. But
Yeah.
some are finding it more successful if they use the phrase autoimmune encephalopathy. And that's what I
Yes.
noticed too. So I thought maybe is that okay if you just speak to that for a moment?
But yes, definitely. So with the pandas and pans are kind of seen as stigmatized terms within the medical field, unfortunately, which is why some panda specialists diagnose it as immune mediated neurobehavioral disorder because they just want to avoid the label of pandas and pans. And that's sadly because, in the past it was considered controversial, even though the evidence now shows it's real. It's very hard to move away from that. So saying that you want to look into some autoimmune issues can be really helpful because that can at least get the ball rolling. With that, though, some autoimmune encephalopathies don't necessarily respond to antibiotics like pandas and pans might, but it can still be really helpful because it allows you to get tests done to rule out other things like various forms of encephalitis and stuff. So that can be really helpful. I do also want to note, though, that some doctors will say, I say this because I had this, that if you have a negative ANA and CRP level, then you can't have pandas or pans, but that actually isn't fully true because ANA is anti-nuclear antibody. That can be a sign of a lot of autoimmune conditions like lupus, but it isn't always elevated in pandas and pans just because that's more related to neurological antibodies, which sadly aren't really tested for under the NHS, like anti-dopamine receptors. Sadly, a lot of us are forced to get private testing if you want to look into those. But the NHS often can look into other autoimmune issues to rule out other things. And as well as that, CRP levels, a C-reactive protein, that's a marker of general inflammation. But again, because the inflammation is in the brain, it doesn't always show on the CRP levels. So yeah, some doctors might be kind of resistant to a potential inflammatory or autoimmune cause on the basis of those tests being normal, but that doesn't necessarily rule out pandas or pans either.
Really, really helpful. Thank you so much. It's for anyone if you're looking for starting the path. I think kind of knowing what barriers someone else might put in your way for even starting that track is really, really helpful. And another, just a comment coming in, and then I'll let you get back on, Romy. Thank you. Was
Sorry.
the bringing up the idea of so looking, it sure seems to be important to be looking for and recording all these kind of unexplained multiple changes that might be happening. And then I
Mm,
think just keeping that log, keeping a journal or whatever. I know I sometimes you don't notice a change if you've been living
mm.
with that person over time or even yourself, but actually if you keep that log, so that you can present that with evidence would be really helpful too.
Yes, definitely. Um, Definitely keep a log, keep a paper trail, because sadly, when you have a condition like this that's really misunderstood, you are constantly having to back yourself up because you will meet doctors along the way who will say they don't believe in things like pandas or pans, which is really sad because it's strange that they can say they don't believe in it when it is recognized now, but sadly, you do still face that kind of stigma. So definitely keep a log, definitely. Sorry, where was I? I think I was here. Sorry, are you happy for me to continue, or do you have another question? Or sorry.
I realize I would like to ask you if you wanted to have a break.
I'm definitely okay to have a break. Would you like a break? Okay.
We could do a break. Maybe that's for the group. Yeah, because we're already at 6:40. It's amazing how time flies.
Yeah.
Rami and I were talking about before everyone coming in that breaks can be really, really helpful for the speaker, for people helping host, and also even attendance, because breaks, when you're taking in lots of information, help you just process that information a little
Mm-hmm.
bit. And also just like we could do like an official break, maybe, or or it could be no. I don't know why I feel like I'm being bossy and telling us when we have to take
Oh,
a bigger
no,
break. I
not
want
at
to just
all.
because I don't like to always take a direction from other people. So I try to just um be careful. But I guess if I'm the one hosting, I probably need to be in charge of some structure. Um, Rami, how long are you feeling? Do you want this to be a mini break or do you want to be able to turn your video off for a few minutes?
However long you want to.
Why don't we say, and I know this on recording for some of you, that we are going to take a little break. So I have 18:42. Should we say everyone take 5 minutes?
Hmm.
And so we can run to the loo, we can reheat our tea, whatever we need. So take your 5 minutes, and then we'll come back. And so again, if you are listening to this at a later time, we're going to go about 5 minutes. And so maybe a good time for you too, before you just jump ahead. Maybe you need to do a movement break too, or go get that snack you've been meaning to get. That could be a good idea too. And actually, I can feel that I am having those tingly feelings in my feet because I haven't moved them for a while. So I'm definitely going to move. So I'll turn my video off as well. And so we'll come back at like the 47.
Okay.
Perfect.
See you all soon.
Hello, everybody. Hello. So we're only just getting to the 6:47.
Oh, sorry. Sorry.
Hello. Well, no, I said something kind of weird, so I think I might have triggered you there. But
Sorry.
just no, we're just getting back. So maybe here is starting to chat and you can start making your way over too, or maybe you need more time and that's okay too. And if you're watching at a later time, I guess maybe restart now, or you would have already because you wouldn't hear me talking. So um, um, would someone mind, or maybe a couple mind letting us know if you're back? So then maybe we'll wait till we see that. And that way we know we're perfect.
Whee!
Thank you so much. That's really kind. All right. Well, when you're comfortable, Rami, you're welcome to share your slides again, and I'll
Fabulous.
quiet
Let's
myself.
fuck off. Sorry. I love how you're so calm and my tics just interrupted with that. Oh
Okay.
dear. Whee!
Like we were saying, oh, no. Now it's end of day where my brain, like I get a thought and it just leaves, but the discussion of like how great it is that we are all so different, or we all get to come into the spaces of learning and educating from each other, because actually it would be so boring if we were all the same and presenting the same. So, and actually, I'm writing down, you're back with a piece of cake? Okay. And then this other person's back with a chocolate bar?
Sorry.
Hang on a second. I was going to say something thoughtful, and then that totally, like, I did not grab any of that stuff and
Food.
really
I want
regretting it now. Oh my
food.
goodness.
Sorry.
That's hysterical. Should have done that instead of just getting more herbal tea. That was really smart of you both. I applaud that. That's excellent, excellent. Oh, and someone else is going, oh, they just put dinner in the oven. Well, I mean, well done for doing that. I know, but don't we all just want some cake now? But enjoy your cake, enjoy your chocolate bar. That is wonderful, wonderful. All righty. All righty,
Woo!
my dear. I think we're back.
Yay!
Yay.
So I hope everybody had a lovely break. I think I was on this bit last about the common misdiagnoses. So of course, there's Tourette syndrome because it overlaps. Woohoo! Fuck, quite a lot. But again, it can co-occur with these as well. ADHD, oppositional defiant disorder, avoidant restrictive food intake disorder, various anxiety disorders, functional neurological disorder, and even bipolar disorder. There have been some cases where pandas, woohoo, fuck, all PANS has been misdiagnosed as bipolar disorder because it can cause mood swings that, depressive, manic. It does resemble that quite a bit sometimes. But the interesting question is, why do some people get PANS and some don't? Because, woohoo, of course, people have infections all the time. So why do most people not get PANS, but some people do? And the answer really is thought to be that it's actually genetic. A lot of people don't realize this. I see a lot of people say that they can't possibly have PANDAS or PANS because OCD and tics run in their family. But it's actually quite common to have multiple family members with PANS or PANDAS. The genetic change, that's the predisposition. That means that you will react to an infection in that way. So changes in the mannose binding lectin 2 gene, the PPM1D gene, and the CHK2 gene have been linked to the development of PANS. Fuck off! Taxes! So treatment is obviously quite individualized, but can involve things like antibiotics to address the triggering infection, but also due to the immunomodulatory properties. Antihistamines are sometimes used because allergens can trigger inflammation and trigger flares as well. That's why a lot of people flare when the pollen's high. Fuck off. Woo, sorry. Antivirals are also sometimes used when it's triggered by a viral infection. Ibuprofen is sometimes recommended to manage the inflammation, but seek medical advice on that, of course, because long-term ibuprofen can destroy the gut. So, be careful with that, obviously. Steroid bursts are sometimes used to completely dampen the immune response so that there's less inflammation in the brain. The steroid burst can be anywhere, usually from 2 to 10 days sometimes. And some people find that it makes their tics and rages worse, but it can be really helpful. Intravenous immunoglobulin, which is it's basically thousands of blood donors' antibodies pooled together, and it's put into a vein, and that is not really used in the UK that much. There was one hospital in the UK that was giving it to children with PANDAS and PANS, but I don't think they are at this point. Unfortunately, you can't get that under the NHS. It's really for the most severe cases, so people are kind of forced to travel abroad for that, which is really sad. Dietary changes can help if reactions to food are triggering inflammation. That was actually a big thing for me. It's not really spoken about very much because it can be deemed a little bit unconventional, but because allergens can trigger it, just like pollen, some people are sensitive to certain foods. Supplements can also sometimes help. Some specialists recommend PEA, and also vitamin D is often prescribed just because vitamin D deficiency is very common in people with PANDAS and PANS. Symptomatic management with things like antidepressants and antipsychotics are sometimes used, but you do have to be careful because a study from Stanford did show that people with PANS are more sensitive to SSRIs, for example, and often need a much lower dose, especially to start on. And therapy can help with symptom management as well, but it isn't enough on its own because it won't address the other symptoms like developmental regression. And also sometimes the symptoms are just so debilitating that you can't even engage in therapy before the inflammation's been reduced. So the common sense approach is to address what's caused it and then work on symptom management. It is actually quite common for other things to co-occur with PANDAS and PANS. One study found that 9% of children with PANS have postural orthostatic tachycardia syndrome, which is basically where when you stand up, your heart rate skyrockets, and that can cause dizziness, fatigue, nausea, sometimes fainting, but not always. Mast cell activation syndrome, which is where the mast cells respond to things like allergens and everyday things like scents by releasing too many inflammatory chemicals. Lyme disease can co-occur as well and cause neurological symptoms if it's affected the nervous system. Mild encephalomyelitis is also a co-occurring issue for some people. It can cause severe fatigue, weakness, post-exertional malaise, dysfunction of the autonomic nervous system, food sensitivities, and also, interestingly, hypermobility and Ehlers-Danlos syndrome seem quite common in the PANS community as well. Another thing to note is that the majority of people with PANDAS and PANS have a normal MRI brain scan. Not all. I do know some people who have had abnormal findings when they've been untreated for a really long time, but a normal MRI doesn't rule out PANS, nor does it automatically mean FND. I say that because some people say that they have FND because their brain scan was normal, but a lot of people with PANS also have normal MRIs. And that's because the inflammation is sort of like microscopic and also so deep in the brain. Hey, PANS is diagnosed based on symptoms and clinical history. Interestingly, no tests are actually mentioned in the diagnostic criteria. However, these tests are important to rule other things out, and as well as that, to see if evidence of inflammation or infection can be found. But the symptoms are important in the clinical picture when diagnosing, because sometimes you are diagnosed based on the fact that just nothing else really fits. And also your response to treatment is a big part as well in the diagnosis. The International OCD Foundation states that PANDAS symptoms will only stop once an infection is fully treated, and this is why you have to address the root cause first. There are some people with PANDAS and PANS who spend years in psychological therapy, myself included, without it really helping because it won't be able to help until the root has been addressed. Whew. Hello. Fuck off. Interestingly, because PANDAS and PANS, they're acronyms, and the P stands for pediatric, which means kids, children's, people assume that it can't affect adults, but the National Institute of Mental Health actually lifted the age restriction because people of any age can actually develop it. There are people who have developed it in adulthood, but as well as that those of us who developed it in childhood, we don't magically grow out of it by the age of 18, unfortunately. So it can be a thing that affects adults as well. That's why a lot of people in the community have tried to advocate for a name change because the P is misleading because it says pediatric. Some people want to change the name to basal ganglia encephalitis, but there is a huge debate within the medical community as to whether PANDAS is a form of autoimmune encephalitis or not. So it's a difficult thing, but the name isn't fully accurate anymore. So when should you actually consider PANDAS or PANS as a possibility? Well, if symptoms get worse with infections or bugs, that's a big sign. Although, interestingly, as I've said, they're not the only trigger. Some people find allergens very triggering because that can trigger inflammation. Woohoo! You look like a cunt! Fuck. For some people, it's metabolic factors that are making things a lot harder. But, if you get worse with infections or bugs, that is a good sign that it's not purely psychiatric or purely Tourette's or something. You might not develop the flare as you're ill, but sometimes shortly after the initial illness symptoms have passed. But also sometimes it's before you even get the usual illness symptoms. Like for me, it's always about a week before I actually get the illness symptoms, because when you're infected with a bug, there's an incubation period where it's in your body, but it isn't causing symptoms yet. But unfortunately, the body can kind of detect that and trigger a flare before you even have the normal infection symptoms. Some people with PANDAS and PANS don't get normal infection symptoms at all. They just present with the neurological and psychiatric symptoms. It can be helpful to consider PANDAS or PANS if the case doesn't respond well to typical OCD or tic interventions, because sometimes that means that there's a root cause that needs to be addressed first before those things can really take full effect. It can be helpful as well to consider it when symptoms such as psychosis, restrictive eating, academic decline, or developmental regression occur alongside OCD or tics, because those traits are very much PANS related, less than linked to Tourette's or classic OCD. If you notice neurological or psychiatric symptoms getting milder when taking antibiotics or anti-inflammatories, that's a big sign, because that doesn't really happen in Tourette's or purely psychiatric conditions usually. Although the first antidepressant discovered was actually an antibiotic, I think, so that's quite interesting. But this isn't to say that everyone will get better with antibiotics or anti-inflammatories, because some people, like a small percentage of people, have really complex cases where they might not respond to broad spectrum antibiotics because they might have a chronic infection that needs a very specific antibiotic combination, or it might be more virus triggered and an antiviral might be more helpful. The anti-inflammatories like ibuprofen can be really helpful for some people, but not for everybody. Some people may need something like an antihistamine or mast cell stabilizer if the inflammation is actually coming from something like an allergen. So what should you actually do if you suspect PANDAS or PANS as a possibility? I think the approach really differs depending on whether it's close to the onset or whether you've gone undiagnosed for a really, really long time. So if it's close to onset, then getting tested for strep can be helpful, because that would definitely back up a PANDAS diagnosis. An ASO titer can help. I think it's titer. The ASO test can detect a very recent strep infection, whereas the anti-DNase B1 detects one that happened months ago. But there is an issue in which, if you have been undiagnosed for years, you might test negative for strep because it was years ago. That can be problematic, because when I was younger, it was actually assumed that it was impossible for me to have PANDAS or PANS because I tested negative for strep 2 years after onset. But it wasn't years later until I was told by a charity that that doesn't mean you don't have it, because it's not going to be in your system 2 years later. Testing for other infections can be helpful as well, because, of course, PANS is triggered by factors other than strep. It can be helpful to take a PANS PANDAS UK leaflet to your GP. They are an absolutely incredible charity. I love everything they do, and they have worked tirelessly to educate GPs. I think it's like 6,000 GPs have been educated on the conditions now, which is amazing. So taking a leaflet to your fuck off GP can be really, really helpful to help them understand and see if you can request a trial of antibiotics. Again, if they don't work, it doesn't necessarily mean it's not that. But if it does work, that definitely backs up your case. If needed, you can see a private specialist, because unfortunately, as I said, it is a bit of a postcode lottery. There are some PANS PANDAS specialists under the NHS, but a lot of the time, doctors will only refer to doctors within the specific area, so it's a postcode lottery. Some people are forced to go private, unfortunately, but in that case, you can get an individual funding request to help pay. You can ask your GP for that. It's a bit of a complex, drawn-out process, but some people have succeeded in getting it, and it has gotten them the care that they need. If it's been years after onset, you will have to see a specialist. You can try your GP first, But usually, if it's been longer, it's a bit of a more complex case and treatment takes a much longer time. So sadly, the NHS can be kind of limited in what they can do, which is why I hate to say it, but usually people only get help within the private sector, which is why fundraising can be really helpful on platforms like GoFundMe, but also, again, individual funding requests as well. If symptoms don't fully remit after treatment from a PANDAS specialist, you can consider other factors such as chronic infections, because the reason some people don't improve is because they have a chronic infection which isn't recognised yet by the NHS, which is really difficult actually, because I nearly died from a chronic infection that the NHS didn't recognise, and I had to get overseas testing and private treatment. It was horrendous. But thankfully, I'm here. So, and also other factors as well. One study showed that refractory PANS cases can be caused or associated with a condition called cerebral folate deficiency, which is a rare metabolic disorder. But sometimes when that's managed, the symptoms do decrease dramatically. Folate receptor antibody testing is sometimes recommended in that sort of case. So does it really exist? Of course it does exist, otherwise I wouldn't be speaking about it. But because there's a lot of controversy around it sometimes, I just wanted to reiterate, fuck off! Sorry, that it is recognised. PANDAS is recognised by the World Health Organization, and it is mentioned in the International Classification of Diseases 11 under the code 8E4A.0. And the conditions are also recognised by Stanford, Harvard, and Yale, which are some of the most prestigious universities. Stanford has their own immune behavioral health clinic, and Harvard and Yale have both done studies on it as well. And both PANDAS and PANS are recognized as causes of OCD by the International OCD Foundation. So it is backed up, it is recognized. It's just sad that a lot of doctors haven't really heard of it that often. Imaging studies by Stanford University have shown signs of inflammation in the brains of people with PANS. These are not the same as the typical MRIs used in hospitals. These are like research grade, and they can use AI and things to analyze, so they can find more detail. But as well as that, Yale identified antibodies that are associated with PANDAS. So, there is actually a lot of evidence that this is inflammation related, this is immune related. It isn't the same as a purely psychiatric condition, for example. Something that I really wanted to talk about, and that I'm actually really passionate about talking about, is PANDAS and PANS in autistic people, because I am autistic myself, and unfortunately, doctors' attitudes towards my autism diagnosis were one of the biggest barriers to me accessing medical care, because doctors would kind of look at the autism diagnosis and assume that it's all autism, which meant that my years of being unable to dress myself, walk up the stairs in my home, hours worth of rituals, it was all blamed on autism. So I was really just left to suffer because I'm autistic. And then again, when I was 20 years old and I developed weakness so severe that I was using a wheelchair, I struggled to breathe, I struggled to swallow properly, vision changes as well. That was blamed on autism for some reason as well. So, and that latter bit wasn't PANS, but that was a chronic infection that was associated with PANS. So, unfortunately, doctors' attitudes towards an autism diagnosis can be absolutely terrible in some situations, and you really have to fight for yourself because there's a lot of diagnostic overshadowing. And the thing is as well, that I don't think it's right to just say, well, you're autistic, deal with it, because autism co-occurs with other conditions a lot of the time. So it's wrong to just say it's all autism. That's just neglectful. Autism can co-occur with things like epilepsy, PANS, pretty much anything, because we're not immune to conditions that affect non-autistic people, but there are some conditions that are more common in autistic people as well. Shut up, you cunt! Fuck, sorry. So, sorry.
Romy,
Yes.
when now to ask a question, there was a question that's kind of related to what your last slide was. If
Yes.
that's okay.
Yeah.
You brought up autistic people, and this kind of fits in there. But I think brings up a really good question that I think a lot of people right now, and then also listening later, would find interesting. We have a parent asking or letting us know they're trying to distinguish between PDA and PANS and wondering if low demand parenting strategies help. Does that mean it's likely not PANS? Real quick, if people don't know what PDA is, that's either goes by pathological demand avoidance or pervasive drive for autonomy. it's considered um like some people call it subset or its own neurotype, like as part of autistics. I'm very much in the I'm willing to hear and listen from everyone. So that's why I'm stumbling over my words. I wanted to make sure I'm being as inclusive as possible. But the best of our knowledge right now, PDAers are also are described as being also autistic, and that's why I thought I'd bring it up on this slide. So it's again the question of trying to distinguish between PJ and PANS. And it sounds like they're putting in a lot of work and time and effort around moving towards low demand strategies, which often greatly help PDAers. And wondering if that is helping in some ways, does that mean PANS then isn't part of this?
That is actually an incredible
It's
question.
a really hard question to answer because
Yeah,
it's so layered.
because
Um,
it's something that I think pretty much all of us who are dealing with both autism and PANS think about. I've doubted various diagnoses before, but I think it's first off important to say that PDA and PANS can occur, so it isn't necessarily just one or the other.
mhm.
As well as that, low demand strategies can help people with PANS because um, with PANS, anxiety is very high and that can make demands difficult. But for a person who already has PDA or elements of demand avoidance, the increased anxiety caused by PANS can make the PDA and demand avoidance seem more intense. So it doesn't necessarily mean that it's not PANS. It could very well be both.
That's my gut reaction too. And also, so I'm a PDA and like I also know in our community, like you mentioned, it's so high with connective tissue differences, with that hypermobility, Ehlers-Danlos,
Mm,
like so many other things to where I think kind of keeping that open mind. And then also if we have
mm,
PDA or maybe in burnout, that's really another layer of trying to distinguish between, because there's, again,
mm,
like some of the skills during that time, because the person is just in recovery um,
mm-hmm.
and trying to recover. So that's a really great question. I think it kind of comes back to that idea you've brought up a few times, Rami, or touched on of keeping that curiosity open. And if you can or you feel like it does fit to maybe still start a pathway of investigating.
Mm, definitely.
Um, and it sounds like what you're doing is helpful regardless. And I also think low demand strategies are just, I think, because it's all about collaboration and co-creation. So I always think that's great for anybody. So thank you
Yeah.
for bringing up that question. And if we have more maybe that our brains go on, we can discuss a bit more in the Q&A. But thank you so much for that one. Oh, sorry. There's related to that
Mm-hmm.
is Hillary. Hillary is a trustee for PDA Society is here. Yay, I know. Yay, Hillary. And so they are working with PANDAS UK. So
Yeah.
and thank you for mentioning that because you said that to me this week, Hillary. And I'm sorry that didn't come to mind right when we were answering this question. Is I think the parent that asked the question, it would be fantastic to get then linked in with the PDA Society, and find some more supports in there. And also that being like then linked in with PANDAS UK and PDA Society to get like a fuller picture, could be really, really helpful. And I think I answered, oh, thank you for answering that. Okay, I'm in the US. Does that matter? Oh gosh, please connect in with us. Um, so you're correct that the PDA Society UK, I believe, and actually Hillary, I don't think there has to be because it's such a big
Taxes.
there are
But
differences in what maybe now our charities tend to sorry, I shouldn't answer that. Some charities do have their funding where can only then support someone that lives in certain postcodes. But I don't know with PDA Society, you tend to run webinars that go out to kind of everybody. So I don't think that should matter. Yeah, you can help anybody. So, and I think Hillary, you might have already dropped in your link. But to the other parent, yes, please link in with them. It's a very comprehensive charity. So that could be
fuck
really,
off.
really
Sorry.
helpful.
But beans. Sorry, it's ticking.
No, no, no worries. Apologies that sometimes when the chat moves, I'm visually quite sensitive. And when things move, it feels like it's like whoosh, like some big like plane that moves. And I constantly have to try to refine myself on the screen. So
Yeah.
apologies. Sometimes if I miss a comment or your question, please know that I didn't mean to on purpose. It might I just visually might have missed it. And you're always welcome to add it again in case I missed something. Okay, and Hillary again is saying PDA Society is happy to help anyone they can. So, yes, wherever you are, that would be fantastic. All right. I will then let you get back on, my dear.
Thank you. And yeah, that actually was a really amazing question, because that is, as I said, that's something that a lot of us wonder. And I mean, just adding my own experience here as well. I'm not diagnosed as having a PDA profile, but I am autistic with traits of demand avoidance. And for example, when I was a kid, if somebody told me to do something, then I was like, well, now I can't do it. That got worse in PANS flares because my anxiety was a lot higher. So I think regardless of whether PANS is a factor or not, low demand parenting, as Laura said, it's very, very helpful. So yeah, definitely keep going with the low demand parenting. That can be so helpful. So, woohoo! How might pandas and PANS look in an autistic person? And I am also very passionate about this because a lot of people don't realize, but those of us who are autistic, we can express distress differently. For example, we may have an increase in meltdowns and an increase in stimming when experiencing some kind of distress or discomfort. And unfortunately, it's so common for doctors to just say, oh, it's because you're autistic all the time. But really, we should look at these cues, look at these signals. If a person is experiencing more meltdowns, more stimming, more signs of distress, why is that? And also, of course, the typical PANS symptoms as well can be seen in an autistic person, but they may be mistaken for other things. So, for example, tics might be mistaken for stimming. Fuck. Rituals in OCD may be mistaken for general ritualistic behavior in autistic people. An increase in sensory overload is often seen in PANS, but again, because sensory overload is also common in autistic people, there's a lot of diagnostic overshadowing, and that can make accessing proper healthcare so difficult. But at the same time, people, just like any person with PANS, can experience symptoms like psychosis in very severe cases. And there is something referred to as autistic catatonia, which is kind of, I'm definitely not an expert in that, but it's kind of where a person becomes rigid and unresponsive, and they can be postured in certain ways. Sometimes it can affect the autonomic nervous system. It's not common, but it can happen. However, that can also sometimes occur in people with PANDAS and PANS, because PANDAS and PANS can cause psychosis, and psychosis is another cause of catatonia as well. So that's another consideration as well. If something very serious like that develops, you have to look into all potential causes and not just say it's autism. So I think it's very important to just recognize that automatically assuming everything is part of autism can mean that something's amiss. So we have to keep a careful eye and just be curious and say, why is this person struggling more? What's going on? How can we help them? So it can be important to consider PANDAS or PANS for anyone, but for autistic people, it's simply because we obviously deserve the same access to healthcare to address co-occurring medical conditions as anyone else. We're not immune to PANDAS or PANS, so it's wrong to just say it's all autism when something else might be going on. And if all of the struggles are blamed on autism when it actually is co-occurring PANDAS or PANS, then these struggles like OCD and tics and potentially other things like anxiety and depression will just get worse because the underlying infections, inflammation, and autoimmunity are being left untreated, which is really unfair that just because we have an autism diagnosis, we can't access healthcare. So if an autistic person suddenly starts struggling more or experiences a so-called regression, then you do have to consider the reasons why, not to fit someone into a neurotypical box, but to be aware of the sort of distress cues and the signs which can signal that something is going on and that person needs more support. Of course, you have to consider social factors such as, is the person being bullied? Are they in burnout? Have they been socializing too much? Environmental, such as, is this sensory environment good for them, or is it too overwhelming? Are they getting the right environmental accommodations? But also emotional and medical. Emotional difficulties like anxiety, depression, those sorts of things can also lead to a person struggling more, of course. Medical factors as well can too. And PANDAS and PANS are a mix of the last two because it's a medical issue that can cause emotional difficulties. And obviously, this isn't aiming to cure autistic people, of course. I think people get confused when I talk about the link between autism and PANS. Obviously, it's not. to try and cure us or whatever, or fit us into a neurotypical box. It's simply because sometimes it co-occurs, and just like anybody else, we deserve treatment to give us a better quality of life. So I think that it's the same as you would assess an autistic person for OCD or ADHD or epilepsy, conditions which are known to co-occur at higher rates in autistic people. But also we have to be aware that in an autistic person, why am I stuttering? In an autistic person, the difficulties and distress may present a bit differently than what you might expect. Flares are difficult for anyone. So these are tips not only for autistic people with PANDAS, but for anyone with PANDAS. Flares are horrendous. They are when you get an infection and the symptoms increase by, 100-fold, it feels like sometimes. So I think it's just really important to remind yourself that flares pass. It is possible for PANDAS to be chronic static, meaning that you don't really see flares and it's just always the same, always bad. For some people, it is more sort of in flares. So a person may be really struggling for months and then do better for months and then keep going in that pattern. So it can be helpful to remind yourself that flares pass, especially if you've kind of been able to predict how long a flare is going to be. For me now, they're usually about 3 weeks of the worst symptoms. So I'm able to remind myself, like, in 3 weeks, I'll probably be fine. And that can help you get through that sort of difficulty. Ensuring you have a supportive healthcare team who can support you with the use of things like ibuprofen, antibiotics, antihistamines, or anything else that is included in the treatment plan. Obviously, that's easier said than done because it can be hard to find a healthcare professional who really understands it, but I promise it isn't impossible. Grounding techniques. Some people find grounding techniques helpful when they're experiencing panic. I personally don't really, because the symptoms can be just so intense. But I use sensory regulation mainly. Like, I don't respond to the normal grounding techniques or deep breathing. I respond to a more sensory-based approach. So, like aromatherapy, taste. Like, I use mints, and that kind of shocks me back into, okay, I'm here. Cold exposure kind of helps as well. But the normal stuff, like visual grounding, doesn't really work for me. Creating a quote book, that's obviously not going to address the root, but it can again help somebody cope during a flare. You can include reminders in there that the person is valued, that they will be able to overcome these difficulties and things like that. Obviously, a therapist is ideal to help cope with the emotional impact of these conditions, but sometimes people struggle to engage with traditional therapy or face kind of discrimination even. Because therapists might say things like, well, they don't talk enough, so talking therapy isn't going to help, which is ironic that you can be turned away from therapy just because you're struggling too much. So in that kind of case, mental health chatbots, you have to be so careful with those, though, because some of them are terrible. Some of them can be kind of helpful, though, and can help you cope during really bad times. Pain management, if tics cause pain, of course, is the obvious of like paracetamol, because tics can be painful. Like if you jerk your head constantly or tense muscles, it can get quite sore and it can lead to injury. So not only the typical pain management strategies like just paracetamol, but also things like Epsom salt baths can calm the muscles, which is helpful because tics can lead to a lot of muscle tension. Things like hot water bottles as well can be helpful for reducing that discomfort and pain. It can be helpful as well to get support from a SEND charity or advocate if the school doesn't understand the need for prolonged absences or an increased level of support and accommodations. It can be helpful to prioritize rest because obviously it's just exhausting when you're in a flare and you're ticking all the time, doing rituals all the time, anxious all the time. All of that takes a lot of energy. So honestly, just prioritize rest as much as possible. And that's not just for the person with PANS, but I would say for family, although I know that's easier said than done because you're kind of a full-time carer. But any little thing you can do take care of yourself as well. Reducing demands can be helpful. Again, not only if a person has PDA, but just to reduce anxiety in general. When you're so overrun dealing with OCD, tics, literally everything else, anxiety, depressive symptoms, etc., the most basic thing can feel like a mountain. So, it can take me hours to convince myself to do the most basic thing, like take a pill or brush my teeth. So it can be helpful to reduce demands where they can be reduced, just to take the pressure off, and that really helps. Also, don't punish a person for their symptoms. I know this should be common sense, but sadly, a lot of doctors don't really understand not only PANS, but neurodivergence in general, and might kind of say that you should punish someone for rages or defiance, but that just increases anxiety, which doesn't help. For example, with rages, a person usually knows that they're wrong, but we can't control it. So instead of punishing us and lowering our self esteem, it's helpful to try and find the triggers and address it from there and help the person find ways to cope with it. Um, Also, be open minded about different approaches because different things work for different people. As I pointed out, for some people, infections are a big trigger. For some people, it might even be things like pollen or anything that raises histamine. So you have to have a very individualized approach. And I would also recommend seeking support from online groups like the PANDAS UK Facebook group. They are an absolute legend. That group is just filled with so much helpful information that has helped me so much and has helped so many others. So don't underestimate the sort of support that you can get from those online groups either. So for further information, I would recommend going to the PANDAS UK website and Facebook group, as I said. I'm currently not affiliated with them, but I used to volunteer for them, and they are amazing. Woohoo! As well as this, the Alliance to Solve PANS and Immune-Related Encephalopathies website. They are American-based, but they can really help people anywhere. They are amazing as well. And interestingly, that second organisation is actually run by someone who has PANS, which I think is good. The PANDAS Network website is pretty good as well, and the Inflamed Brain Collaborative is brilliant because they don't just focus on PANDAS and PANS, they focus on how inflammation can be related to many different psychiatric presentations, because studies are showing that things like depression, bipolar disorder, and schizophrenia are related to inflammation and immune issues, and that kind of issue. For example, I'm trying to remember it. There's a lot of antibodies that have been associated with schizophrenia, a lot of inflammatory markers that have been associated with depression, and they are kind of helping revolutionize Sorry, I am talking way too fast. They are helping improve mental health care for people who are labeled treatment resistant, because it might actually be that there's an immune factor that needs to be looked into and addressed. Does anybody have any questions? I've been talking for so long now, I am falling over my own words, so sorry about that.
Not at all, but I know the feeling because it's very different when you're the main person speaking. The sense of time starts
I
to
know,
feel very warped, and you're like,
I
am I
know,
talking too
sorry.
slow, too loud? What's happening?
Yeah, sorry.
We had someone just saying thank you so much for this evening. They're going to leave because they're not feeling this. They need to go have a rest. But they'll
That's
get the webinar sent to them as well. I haven't seen any other questions coming in. I was just trying to add some of the links. I hadn't heard of, oh, it was the Alliance to
mm.
Solve. I don't know if I had the one. I have it was Aspire. Oh,
Yeah,
okay.
that's
I do know
that's
Aspire. It's funny how I didn't put the acronym together.
sorry, it's okay. Sorry,
Sorry.
I should have said the acronym. It's Aspire. They are
No,
amazing.
that's just so funny. So I'm going to add them in now. Let's see. If I go back to the main meeting group chat, sometimes it flips around. So let me add that. Here's that Aspire. Um, I should say that my plan, tech, I'm always surprised by myself every time. I'm like, is it working? Is the template email that will go along with the recording of the webinar will also have then the link to that blog that has all the resources listed and linked.
Yeah.
If you hadn't seen that before, it was in the Eventbrite, I believe, as well, but just in case, so that way all those links will be there for you too, if you don't catch them in the chat. But that's sometimes people like to look at them at the same time. But I haven't seen. Oh, here's a question. Oh, I might have missed. So the question is this related to RCCX theory? Although, because I'm reading it now and I'm going, I'm so sorry. For the person who wrote this, do you mind putting what you were asking about? I'm sorry, because now it's gone on in time and the connection of you're asking. So is this related to RCCX theory? I don't know if I'm familiar with that. I'm going to need to look that up.
I don't
So
know what that is either. Sorry.
RCCX theory. It's a great question because we're like, we don't know. Um, and that's the whole thing, right? So variations. It's a gene cluster on chromosome 6, if this is the same one, a genetic basis for a wide range of overlapping chronic medical conditions, including autoimmune diseases, psychiatric disorders, and neurodevelopmental conditions, is what my phone is bringing up.
Hmm.
No, I hadn't seen that, but I mean, I do think there's a lot to be said around why do certain groups seem to have some of the same medical conditions coming out, or that we're more prone to certain ones. So I know I can't answer exactly this because I haven't really dived into it, although I'm going to save it on my phone, so I do. So thank you for that question. Rami, were you saying you also weren't quite as familiar?
No, I'm sorry, I haven't heard of that before.
Oh, that's okay. We can't know everything. That's why we have webinars, because we need to learn from each other. So that was a
Hmm.
great question, because actually now we're going to both probably
Yeah,
rabbit hole with that. And so, um, there is a question around you sharing the slides.
yeah,
I don't mean to put you on the spot. Before you answer, so you don't feel one way or the other, my general with slide stuff um, is thinking of protecting the speaker, that often slides in webinars aren't shared in order to protect that person's work. But you are going to be getting the webinar and then all the links to the places.
yeah.
Um, I was only jumping in not to be bossy, but because I know, thank you for understanding. And sometimes the slides without the speaker doesn't make sense, or sometimes someone can interpret it wrong. But
Hmm.
that, if you don't mind, just because Rami and their lived experiences on it too. So just for also for that reason. But we'll make sure, and if you have any questions or need some more of the links that didn't come in, we'll make sure we can always answer. We're around. You'll have our emails as well. Oh, there's another question if that's okay, Rami. Oh, it
Yeah.
is question time.
Yay!
The slide you put up. I'm sorry.
Yeah, that's okay.
We're on recording that I'm so surprised by this. Um, why don't we do this is kind of more goes into a specific kiddo. Should we do a general wrap up and then go into where we're not recording?
Yeah,
When people can ask about their specific kiddos?
yeah.
I think so too. Okay. So, oh, it's like it surprised us that we got to the end.
Yay!
Okay. Um, would you like to then say how you would like to wrap it up before we say goodbye?
Should I do like a little conclusion?
Yeah, maybe we do that. So again, if you're here live, we'll do a Q&A here just a minute, but we'll stop the recording after Romy does a little bit of a conclusion.
So, thank you so much to everyone who has watched this. So grateful to all of you. Um, and I do hope that this has allowed you to get a sort of introduction to what pandas and pans are, how they're treated, and how they overlap with things like Tourette's and even autism, and how they can co occur. So, yeah, thank you so much.
I did realize as I said that I have this very big note here to say, do you mind, actually, before we hit the button to not record, if we just even say just a little bit around FII? I just
Yes,
have a
yeah,
moment for that because that's
yeah,
part of also my like, why I've really wanted this webinar and to kind of get me back in, I don't know, just learning a lot more and better
yeah.
connected in.
Definitely. It's very sad, but when seeking a diagnosis and seeking healthcare, a lot of families dealing with pandas and pans do get accused of fabricated and induced illness, which is utterly horrendous because it's just really adding insult to injury. Um, but I'm sure Laura can kind of explain, more about what that is and how to kind of avoid it, maybe.
You saying that, it's it's really complicated. Like you're saying, is it feels like when someone's really poorly, um, I get very frustrated as a healthcare worker of I feel like the reason why you go into the fields of taking care of people is one, you really want to take care of people.
Yeah,
And two, you're coming at it, we're all technically scientists, is
yeah,
curiosity and
yeah.
understanding that people are complicated because we are these, we call them back in nursing school days, biopsychosocial, I forgot all the other categories, but we're complicated beings
Mm.
to begin with. Um, And then when someone's not well, they're not just living in this little silo. There's a lot of other things going on. So we should always be curious.
Yeah.
Unfortunately, what I see with supporting families is that they will have someone who maybe the parents started when they were young and taking them in, or years prior and taking them in, and we're told, let's just see, let's wait and see. And
Yeah.
let's give it a couple months, a few months, and see if they get better. Maybe, they're just going through a phase or something. And then as
Hmm.
time goes on, this person gets more sickly and
Yeah.
more poorly. And I think it's really compounded by education policies that are so harsh and strict on absences.
Mm,
And the
definitely.
combination of that is leading to where I see lots of families with having people, oh, thank you for putting that in, Hillary, coming back at families saying nothing is wrong, it's actually parental blame.
Mm,
And so that's where that it's fabricated. It's you've made this up. Your child is not as sick as you think. And
mm,
unfortunately, how I see it done, often in these letters, and families will share these letters they've gotten where it really stops. And you had mentioned that too. It really stops any sort of medical support and
hmm.
any sort of investigation for this person's and leaves people without care. And so
Yeah.
really, really frustrating and it's not okay. And it's something just to really reflect back. So I volunteer on a number of cases that are like this, where I really reflect back to practitioners of let's look at all the evidence in one place again. And again,
Yeah.
just remind ourselves of why are we here in the first place of helping somebody and just
Hmm.
being curious. Let's just, yes, it makes sense that the parent came in really upset and is very emotional because their child is very poorly. Um,
Yeah.
and so
Woo!
instead of throwing that back at them, why don't we sit and listen and get curious? And actually, I consider that as a practitioner that it's on me to learn more, that that's supposed to be my job, that I'm
Yeah.
supposed to try to figure it out. If I don't have the information, I need to reach out to other people. I need to
Yeah.
find it and get really curious and build up my network. So I feel myself getting all like fired up about it. But I do find with PANDAS, this tends to be, um, again, as you had mentioned, it's quite highly stigmatized.
Hmm.
It's new in the books. And so
Yeah.
the practitioners don't know it. And I wonder if there's some of that feeling of uncertainty on their part of not wanting to investigate something they're not as familiar with.
Yeah.
Um, so I just wanted to touch on that because that was definitely part of why I wanted to have this discussion, and bringing it back, I don't know, more into the light and trying to get this into more
Yeah.
people's awareness. And then lovely Hillary from PDA Society dropped in some great articles there for support as well. Because getting some advocacy during that time is really critical to make sure you can still get medical
Hmm.
care.
Yeah. Yeah. Everyone says keep a very strong paper trail as well for evidence.
Absolutely, absolutely. So I think you already gave your goodbye. So I guess I'll just say I thank you again to everyone for coming. I know um, I just feel very grateful to you, Romy, for taking the time and the energy to create the webinar and to also a lot of your own personal life is in here and lived experience. So I always find that humbling that I get to hear that and learn from you. So thank you so much. And for everyone who has been listening to the webinar at a later time, thank you so much for your interest. I hope you find the links helpful, and I guess just get in touch if you need more. And then now you're gonna watch me try to find the button to stop recording. So anyway, thank you so much.